Hello, patient care staff. Sharon Wright, your Chief Nursing Officer, honored to bring you the first videotaped annual nursing and patient care services message. Let's take a look back at 2014. It's one of the most challenging years that we've experienced in patient care in decades. Some of those challenges included Ebola outbreak and our massive response to ensure that patients were safe and well cared for and screened within our community. We also were faced with the direct impact of healthcare reform, creating some of the most stringent financial stressors that we've experienced as an organization. Frontline staff, what did you do? You did what you do every day. You took excellent care of our patients. You trusted your leaders, and we endured one of the worst financial years that we've ever experienced. And we came out at the end of the year financially successful. Let's take a look back at some of our major positive accomplishments. It was a year of change in leadership. We have hired 13 new managers and directors and cross-trained 3 additional house managers house-wide. So with that, it required a lot of coaching and teaching of new leaders, training them in how to handle unit schedules, how to handle crisis management and change management, and certainly how to handle finances. At the bedside, some of the changes that we saw is offering new services. We opened a new bariatric service line on the 4th floor. We moved our oncology center to Robinbrook and now have a comprehensive center that is convenient for patients in an uplifting environment. We also made many changes to our stroke program. We have hired a medical director for the program, Dr. Jeff Millard. We have also named a stroke coordinator. Our nurse practitioner, Sheila Bruce Pretty, serves in that role. We also designated PCU as the primary stroke floor so that nurses in that floor become experts at taking care of our stroke patients. Other things that we were able to accomplish is not moving the staffing matrix for any unit. Despite challenging financial trials during this time, we kept our staffing ratios and nurse-patient ratios status quo without any negative impact to patient care. Other things is we networked with McKendree University to bring a bachelor's program for nurses here on site to Hardin Memorial. And it's the first in the history, at least for the last 2 decades, where the bachelor's program has been offered here in the convenience of Hardin Memorial, exclusive for Hardin Memorial nurses. Other major accomplishments that you need to take credit for is the many awards that we received during 2014. First, we were the recipient of the Consumer Choice Awards and for Modern Healthcare, and we received recognition for Best Overall Quality Care, Best Image, Best Physicians, and Best Nurses. We also received a Studer Group Award in Customer Satisfaction in our Outpatient Division. We received 2 awards from the American Heart Association. One was the Bronze Award as a STEMI Receiving Center, a program that we started just over a year ago. Secondly, the Gold Quality Achievement Award in Resuscitation, meaning that our patients meet higher standards than those nationwide in resuscitation. A couple other things that I want to mention is our shared governance activities, and we did have to halt some of our meetings from our financial constraints and things that the organization was experiencing. But despite that, you carried on and your managers carried on shared governance activities every day. Some of the things that we did was continuing the CAP program, the Career Advancement Program, despite financial challenges. We had a tree planting ceremony. We had a career fair. We had a magnet summit to expose all staff to what shared governance really means. And we break down shared governance. What does that mean? It means you, the staff member, make the decisions on how you take care of patients every day. Those are the decisions that are very best. Those are the decisions that are very best, not those that come from the top down. So as we approach 2015, I'm really excited. We're filming today in the North Tower that will open shortly in a couple of months. And our staff will get to provide excellent care, as they do every day, but in a facility that matches their clinical skills and their compassion for patients. We will also open a NICU this year, and we will also embark upon expanding the emergency department. all of these things with a rejuvenation of our shared governance councils. So come on, I want you to be part of a council. I want you to be part of a council on your floor or house-wide. And I'm looking forward to 2015. Thank you for allowing me to be your leader.